Welcome to the Learning Pines YouTube. We hope this video helps.
You begin by establishing a clear baseline and taking immediate, practical steps. First, track symptoms for 7 days so you can link specific foods or stressors to bloating. Once done, remove obvious triggers for 3 days: alcohol, sugar-rich drinks, and fried or highly processed meals. Make sure to add a daily fermented food or plain probiotic yogurt at a consistent time to support microbial balance. These actions give you data and gentle support for the next, more detailed phase. Now move into the complex but manageable middle steps. Perform a targeted low FODMAP trial for 2 to 4 weeks to reduce fermentable sugars, then reintroduce foods one at a time to find triggers. Meanwhile, prioritize soluble fiber like oats and psyllium at 5 to 10 grams a day, while temporarily reducing insoluble fiber that can irritate sensitive guts. Also, make sure to keep hydration at about 2 to 2.5 liters daily and add electrolytes when you sweat. This supports motility and stool consistency. Finish by layering targeted tools and scheduling habits to lock in gains. Use digestive enzymes or enteric-coated peppermint oil for short-term relief of gas and cramping. Try them with a single meal first to assess benefit. Establish consistent meal timing, 3 to 5 small meals, chew thoroughly, and stop eating at least 2 hours before bed to aid clearance. If symptoms persist, worsen, or include weight loss, make sure to seek medical review for SIBO, celiac disease, or appropriate lab testing as a key troubleshooting step.
Thanks for watching. Consider subscribing if we helped you.